Hello and welcome to Community Pulse. My name is Levi Moore. I'm one of the 3 rotating hosts of Community Pulse, and I'm joined by the other 2 co-hosts. It's rare that all 3 of us are here together. So, co-host.
Tacora Love, Nurses in Humanity and Academy of Med-Surg Nursing.
And
Meghan Phillipp, HC3, the Healthcare Council of Chicago, managed by Third Horizon Strategies.
great. Community Pulse is a public affairs show about public health, life sciences, and wellness in the city of Chicago. First, let me kind of do the obligatory how we're connected. Okay. Our Community Pulse is sponsored by the Hectone Institute of Medicine. It's an 80-year-old public health institution in the city of Chicago that manages public health care programs. I work for Hectone as the Foxglove Alliance Coordinator and a bunch of other stuff too. But Foxglove is a coalition of 15 public health care organizations. And so we've partnered up with Nurses in Humanities and HC3 to do this show. So with that out of the way, well, Meghan, what's our show about today?
Well, today, the last time we were on air, we were talking about what we observed in 2023. And as we kick off 2024, we're going to talk about what we're going to talk about this year and some of the things that are weighing in our minds and hearts in healthcare and the healthcare ecosystem here in Chicago. So to get us started, since unfortunately our close of the year did not include our fearless third co-host. She had a little bit of illness before the holidays, but we're excited, as Levi said, to be all in person together. So Tacora would love to hear what's on your horizon as we kick off 2024.
Oh my gosh. First of all, Happy New Year. And I am so glad to be back in the studio, but so lucky to be back with the both of you here today. So the Hectone Nurses in Humanities and AMSN Chicago chapter, I have to say the whole line here. We had a fantastic year. The Nurses for Humanity, Hectone Nurses for Humanity and AMSN, we were all over the city of Chicago. So definitely want to highlight some of the phenomenal interviews that we had, as well as some of the events that we hosted at the International Museum of Surgical Science. And then just some of the volunteer work that we've done with the Chicago Kindness Campaign and the Guest House, which is one of our new partnerships that we have been doing volunteer work with. So I'll start first with just some of the interviews that we've done that you guys may have seen. So one of the ones we interviewed a lot during Nurses Week, Mary McDermott, who is a professor emerita from our fantastic Loyola. She talked a lot about her love for the arts and then just her passion for Hectone and education. We interviewed Dr. Carolyn Smeltzer, who's a world-renowned author, who's authored several books, but what we focused on was her book, Evanston Hospital School of Nursing. And we talked a lot about diploma nursing. We wanted to increase the awareness and just show the history of diploma nursing. So that was a fantastic interview. And we also hosted a fireside chat at the International Museum of Surgical Science with Dr. Smeltzer. Some of the other ones, like we have so many to cover. Dr. Edward Lynn that we did for Menopause Awareness Day. That was another fantastic interview that we just shared the awareness of menopause and perimenopause. We actually surveyed a couple of women and asked the questions that they did not feel comfortable asking their physician.
Wow.
I asked those questions with Dr. Lynn to get the answers for them, as well as for myself. I actually learned a lot during that interview. Oh. We spoke a lot about menopause isn't something that you just generally discuss. Mm-hmm. You know, it's one of those things where you have hot flashes and you deal with those flashes. But he talked a lot about treatment for those hot flashes and even so much as why we have those hot flashes. So that was a great interview. We also thought about, or still thinking about, doing a part 2 because from that show we received additional questions about menopause. So we're excited about that. Dr. Joshua Hauser was someone else who we interviewed. And we talked a lot about his work with palliative care and with veterans, but how he has introduced poetry as a form of healing and with medicine. So that was phenomenal. And we also did a poetry workshop, again, at the International Museum of Surgical Science. So we were excited about that. We had a lot of community members actually come and take part in that workshop. So that was good. But I think the most phenomenal and fantastic thing we did was Nurses Week. We held an art exhibit at the International Museum of Surgical Science where we had nurses or artists featured from all across Chicagoland. It was focused on, if you guys have ever heard of Judy Chicago Dinner Party, where it is a ceremonial table with seats at the table. So what we actually did was design plates and honored nurses who may have passed, but also our current nurse leaders. So again, it was really well attended and it was just phenomenal. Some of the nurses that we highlighted would be Dr. Janice Phillips, Kristen Ramsey, and then Barb Goebel, and then Lauren Underwood. Although she could not attend, we actually, had a plate and she actually sent a video interview in for that. So that was phenomenal. So what we're looking for towards the future, I'm not sure how we're going to top, the Remembrance and Renewed exhibit, but we have some plans in works. Our phenomenal team has already have plans going on for that. So of course, I could go on and on about Nurses Week, Hectone Nurses and Humanities, and AMSN, but I'm going to stop there and let you guys jump in.
Okay. Well, Megan, do you want to go next?
Well, yeah, I think that was a great recap of the activities from last year from the Nurses and Humanities and the work that you're doing. As we turn the page and look forward, I am reflective of the things that we accomplished last year. A lot of things will be carrying over with HC3. Many of the issues don't just go away overnight. So as I think about programming from last year, we did a lot during Women's History Month, which we plan to do as well. Women's health is still on the line, both across the U.S. and especially here in Illinois. Even though we are a sanctuary state, we are seeing the tremendous need and impact of what that looks like. So I'm very excited that we have some guests on the line to talk to us later this March as we dig into more of those topics, especially during a political year on the federal level. It's good to know what we're doing on the local level. And so I'm very excited about continuing those conversations. I also think there's some other continued efforts around, last year we also had the opportunity to interview the West Side Opioid Heroin Task Force. We are seeing a tremendous amount of investment as well as opportunity, both here in Chicago and across the state. There's a lot of exciting things happening to be reformative in those areas. So I'm excited to bring in some opportunities for us to learn and continue to destigmatize and look for avenues to support our community members as well as our family and friends, because I don't know anybody that's not touched by this issue. So those are some of the things that I am definitely thinking about programmatically for CAN TV and our Community Pulse programming. But even beyond that, in our work in community with HC3, our continued evolution of our HFS Transformation Collaborative with PATH is really exciting. We'll be able to announce later this winter or spring the opening of PATH, Pediatric Adolescent Transformative Healthcare, to be opened on the southwest side. St. Anthony is the lead partner, and there are a dozen other community partners involved. So more to come around children's behavioral health access. And we also continue to think about workforce as one of the big challenges that we hope to be resolved in the healthcare industry. But as I think about it, I think that even our broader audience out in the ethos on CAN TV are probably thinking about this. We're seeing it across the board. We're seeing it in our restaurant industry. We're seeing it in the increased minimum wage. So this is definitely something that will come up in both our CAN TV Community Pulse opportunities and then through HC3's research and collaboration around how we look at this from a well-being standpoint and in taking care of employees. And then also specifically our healthcare workforce and the challenges that we've overcome over the last couple of years and the turnover rate and how we look at the pipeline. So those are some of the things that are top of mind for me as I kick off this year. It feels like not anything too new, but I am very excited and hopeful as we kind of enter a new year. I also want to say it's going to be, and give a shout out that it's going to be very exciting to have the Democratic National Conference convention here this August. I don't know what we're going to do yet, but I'm just saying I'm previewing that I think that we will be trying to get our foot in the door somewhere. Just out of curiosity, because we know that policy does intersect with some of the things that we work on and do here. So I'm very excited to see, hopefully maybe just a peek at some larger figures in our national scope coming here to Chicago. So that's what we have kind of for HC3 and some of the bigger, broader Chicago issues we're thinking about. As we look to our partners at Foxglove and otherwise at Hectone, what do you think you have on the horizon?
Well, I'm going to sort of use Community Pulse as an arm of Foxglove in 2024. The Foxglove Alliance is really a continuation of 2023. We have 4 priorities. 1, we did a show on it last year. We're going to do a show on it this year. IDROP, which stands for Illinois Drug Reuse Opportunity Program. Before we got IDROP passed, it was illegal to donate unopened, unused prescription drugs to free clinics. So imagine a person is switched from one medication to another one.
Happens all the time.
They have quite a bit.
Yes.
Some of these medications can cost $2,000, $3,000, $5,000 a dose.
Absolutely.
So until I dropped, what we were doing? We were actually sending it down to Springfield and burning it up in an incinerator. But we got that passed, and so now it's just a matter of the iDrop coalition. We thought once we got it passed, we were done, but it looks like we're going to have to actually be part of spreading the program, the word, getting new partners. So I know there'll be another.
Fantastic.
I know there'll be another show on that.
Yes.
This is she's probably heard me talk about this. Right before our eyes, right now in Chicago, we are becoming a global life sciences innovation hub. We have billions of dollars that are being invested in med tech innovations that go beyond just 1871 and matter. There's the ARCH development at the old Michael Reese Center. Mark Zuckerberg just has a huge, and this is all happening right now. And I think a big key will be something I've learned too, is that there are going to be thousands of jobs that will be created, but a lot of them do not even require an associate's degree. So as this develops, we really want to, Foxglove, at minimum, we want to be able to promote this.
Yeah, definitely increase the awareness.
Yeah, and we actually have a grant out that we hope will get funded that would assist quite a bit in it. Okay. And if I look really sad, it means we didn't get it, but if not come in, start screaming, that means we did get it.
Yes.
There are 2 other parts, but they're connected. M3R, more minorities in medical research. And this came about, but do you remember your last meeting? Well, no, not you, because you're a nurse. So, but your last in-person meeting before we were shut down. Mine was with Dr. Dennis Levinson. He was a Foxglove founder. And in his day job, his team, they were trying to find a form of the vaccine. Well, they're actually doing clinical trials on a vaccine for AstraZeneca for COVID-19. They were pulling their hair out of their heads because they did not have enough
researchers.
African American or Hispanic participants in the trial.
Yes.
And I asked, well, is that so bad? I said, well, that means that it may not work on certain populations of black people and Hispanic people. Like, oh.
So that's why yeah.
So that's what spurred M3R.
Okay.
And so there are essentially two parts to it. One is sort of tied to the life sciences innovation part of it a little bit. It's to get more black and brown people in Chicago in the clinical trials. And the first show I'm going to do is with this incredible company called Emvenio, EMVENIO. It's a private company, but they are sort of like the disruptors of clinical trials. They're in the Illinois Medical District, but they really operate vans. So imagine some of the issues of a person participating in a clinical trial. Like, I'm taking care of my kids and my grandkids, or I have transportation issues. Well, what if you're supposed to get tested or evaluated the third Tuesday of every month at 2:30, and this van just pulls up?
So dressing a social determinist, that's actually pretty awesome.
Yeah, and it's like what this is uses telehealth, so it completely eliminates a lot of the boundaries in terms of participating in a clinical trial. And we have a lot of clinical trials going on in Chicago right now. It's not, and everything from chronic diseases, but then some of the wild ones are dealing with dementia. That literally there's one I know that they're doing in Chicago where if it runs in your family, if you're at high risk, they're working on a drug that might be able to abate how serious the things.
The progression of it.
Yeah,
Wow.
in Chicago. So, and then the other part of M3R is the solution. It's long term, and it's actually really simple to get more black and brown people to work in healthcare and to actually lead and conduct clinical trials. And I remember when I first bounced this off with some of the people at Hexton, well, that's going to take so long. It's like, well, if it was easy, I'm sure you would have done it already.
Years ago.
So working with a lot of the groups that we work with that are involved in healthcare, in healthcare, but then also workforce development, because I'm sure you know this.
Yes.
There's a shortage. There's a shortage of nurses, doctors, techs, everything.
Our CNAs, yes, for sure.
And I know there's a big push to go down to high school, and then just awareness of jobs at the middle school level.
Yes.
And I know this from Westside United. They've taken it so far as to really hone in on youth that live in the West Side should work at the hospital. So down the road. So those are, the things I want to focus on. I know that there's a possibility that with Foxglove, we're going to try to do 1 or 2 panels focused on just the life sciences innovation from an economic development standpoint, from a healthcare standpoint, from a global positioning standpoint, from a workforce standpoint. And it's even to the point where it's redeveloping certain neighborhoods too. Like I mentioned, like the old Michael Reese site, but then there's a part of Humboldt Park that there's a quantum computing incubator there. So it's not just downtown, it's being spread all around. So that's where a lot of the programs that I want to do are going to come from, those 4 priorities of our areas of focus for Foxglove. And also another one too, a big one. I want to do the legislative wrap-up when the General Assembly adjourns.
Yes.
And it's one thing, there's always stuff going to healthcare, but in 2025, Illinois is going to roll out our version of Obamacare.
Yes.
And it's being developed, and I know it's being fine-tuned. And when I started asking questions about it in August and September, they was like, well, we just passed this, so we got to work on some details.
Yes.
Hopefully by the end of this session in June, there will be details because 2025, in 6 months will be right around the corner. Right. So that's my vision for our show, at least the ones I'm going to do. So,
and just to clarify for folks, what he means by Illinois' own Obamacare is that we are actually going to have a state-based exchange. So when you're looking for your own insurance, it'll just be for our state versus when you go on the sort of exchange right now, it's just kind of very broad, but it'll be much more tailored just for our state, which is actually really good because most of your insurance, if you're not on employee-based insurance, are state-based programs. So it'll really, hopefully, I am hopeful and excited as well, really help us streamline access and really making sure that people are on the right types of programs for what your needs are and what you and your family need.
Yeah. And I know that there was this gap that they found out that especially in gig economy, well, 1 month you're eligible for Medicaid. The next month you might not.
Yes.
This hopefully will just take care of just one of those things. So one of the problems. So.
And I will say that I should applaud our state as well as our Medicaid plans because we were the #1 state to have the least amount of people fall off in the redetermination.
So, sure.
It's not perfect, and I don't want to say that we are perfect by any means, but I do want to applaud our constituents across the insurance realm and our communities for ensuring that we could get the word out that this is happening, and there are tons of resources still to help people get re-engaged and get on the rolls for 2024. So please reach out to folks and look for those opportunities.
Well, it looks like we have some amazing and dynamic things planned for 2024.
It's looking pretty good.
Yeah, so definitely, and Hectone Nurses and Humanity and AMSN, the nurses, we're definitely here to help you guys, and we'll love to help with the workforce and going to speak at schools to help with careers.
That is, we're really trying to do a push because a lot of kids would go into careers if they knew what they entailed.
Absolutely.
But if there isn't anybody in your family in medicine, to a great extent, how would you know?
Yeah, we will be happy. We would love to help.
Okay, I think before we get cut off, it's probably time to wrap up. Anybody want to wrap up? Or do you want me to? Okay.
Yeah.
My name is Levi Moore. This is Tacora Love. This is Meghan Phillipp. We're the Community Pulse team, and our show is on. We air a couple of shows every month. They can be viewed on CAN TV, then also streamed, and then we also have them on our respective websites where you can get to the YouTube channel. So we're really looking forward to our second year, and thank you for watching.
Be well, Chicago.